It just seems like plastic is in everything these days. From water to food, toys, diapers, plastics are in everything. It is impossible to avoid it altogether, so it is important to know the most dangerous plastics, especially in food and water containers. When I found out I was pregnant, I changed the containers that had contact with my food and water first. Then I looked into all the plastics that I come in contact with every day. I was so glad I found out early on in my pregnancy the effects that these plastics have on our babies and unborn children. You will have to be a detective when it comes to plastics because they are in more products than you think or can even see. Let me begin by going through plastic by the number written on the bottom of the containers in the triangle. This is usually the best way to find out what type of plastic is in the product and its level of safety. 1 is PET or PETE. It is used for single-use containers, such as beverage bottles, mouthwash bottles, peanut butter containers, salad dressing and vegetable oil containers, and oven-able food trays. This plastic is considered of medium safety. Number 2 is HDPE. It is found in milk jugs, juice bottles, bleach, detergent and household cleaners, shampoo bottles, butter and yogurt tubs, and cereal box liners. This is considered one of the safer plastics with a low risk of leaching. Number 3 is vinyl or PVC. Phthalates fall into this category. It is found in window cleaner and detergent bottles, shampoo bottles, cooking oil bottles, clear food packaging, and medical equipment. PVC contains chlorine, so its manufacturing can lead to highly dangerous dioxins. Dioxins are linked to endometriosis, decreased fertility, and an inability to carry pregnancy to term. It has also been linked to lowered sperm counts, cancer, diabetes, developmental delays, and immune system disorders. Number 4 is LDPE. It is found in squeeze bottles, bread, frozen food, dry cleaning, and shopping bags. It is also found in tote bags, clothing, furniture, and carpet. LDPE is one of the safer plastics with a low risk of leaching. Number 5 is polypropylene. It is found in some yogurt containers, syrup bottles, ketchup bottles, caps, straws, and medicine bottles. Polypropylene has a high melting point, and so it is often chosen for containers that must accept hot liquid. It is considered a safer plastic and is thought not to leach into products. Number 6 is polystyrene. It is found in disposable plates and cups, meat trays, egg cartons, carry-out containers, aspirin bottles, and compact disc cases. Foam products that are made from polystyrene are also called styrofoam. Evidence suggests polystyrene can leach potential toxins into foods. Last is number 7. There are many different plastics, including BPA, that fall into this category. The chemical that is receiving the most attention in news today is BPA, or bisphenol A. It is a chemical used in hard plastics like water bottles and baby bottles. There are 6 billion pounds of this toxin produced every year. BPA leaches out of these containers and into our food and water. Testing by the CDC has found detectable levels of BPA in 90% of the people tested. The problem with this chemical is it is an artificial estrogen and affects the hormones in humans. It is associated with many diseases and disorders, even at very low doses, including breast and prostate cancer, infertility, birth defects, permanent damage to developing male reproductive organs and fetuses, diabetes, heart disease, liver toxicity, and a host of other problems. BPA has been found in umbilical cords, exposing growing babies to the toxin. Exposure to estrogens are thought to be a contributor to the early onset puberty in little girls. Girls are starting to go through puberty as young as 5 these days. Reducing exposure to these types of estrogens may reduce occurrence of this problem. BPA is found in many hard plastics, especially clear types. Look for hard plastic in food packaging, home small appliances, cups, plates, and even home-delivered bottled water jugs. It is frustrating to pay a premium for bottled water and have it contaminated by the container it's in. We are just beginning to understand the effects the chemicals in some plastics may have on our health and our bodies, and especially to babies and pregnant women. Just as BPA is becoming a chemical demanding a lot of attention, there is a bigger fear from a broader category that BPA is a part of, which are EDs, or endocrine disruptors. These are environmental chemicals that affect the endocrine system, which affects the hormones. You will hear the term ED mentioned in this seminar many times, as they are found in a long list of products and places in our environment. Studies suggest that EDs potentially cause reproductive disorders, such as testicular cancer, decreased sperm counts, and male genital abnormalities, early puberty in girls, and breast cancer. Studies also show that women exposed to EDs may have an increased risk of stillbirths and premature delivery, reduction in milk production, problems with menstrual cycles, fertility, and egg development. So where do you find EDs? EDs include some pesticides, industrial chemicals like PCBs and dioxins, phthalates, phenols, including BPA, and plant hormones. We can't talk about plastics without covering phthalates. I want to talk about this chemical because it's an ED and estimated to be used in over 13,200 products. Phthalates are preservatives that are used to make plastic soft and pliable. Think of plastic wrap or plastic shower curtains. You can find phthalates in plastic, cosmetics, PVC pipes in your home, toys, lining of metal cans, and medical supplies like IV bags and tubes. They are recognized as toxic substances under environmental law, so much so that an environmental release of just 10 pounds requires reporting to authorities. A frightening statistic is that 84% of the U.S. population is contaminated with at least 6 different phthalates at any given time. Baby boys and pregnant women are 2 groups especially vulnerable to the hormone-disrupting effects of these plasticizers. In fact, women of childbearing years whose fetuses are exposed in the womb appear to receive the highest exposure. The problem with phthalates in pregnancy is that they do cross the placenta into the amniotic fluid. They are also transferred to newborns and small children through breast milk. Phthalates have been linked in some studies to fetal death and malformations, as well as defects in baby boys' reproductive systems. They have been linked to asthma, allergies, high levels of estrogen, and liver cancer. Be aware that most phthalates also contain formaldehyde and toluene, which are linked to their own set of diseases and disorders discussed in other chapters. There is a growing awareness in our country about this chemical and a movement to remove phthalates from our food supply and our children's products. However, they are extremely prevalent in our environment, and it is important to be on the lookout. For those of you who would like more information on phthalates, I do discuss phthalates in the body section, home section, as well as children's products in the Organic Baby University seminar. So the best way to protect yourself is by avoiding plastic wherever you can, especially in food and water containers and children's products. Be aware that the safer plastics are numbers 2, 4, and 5. These are not thought to leach into foods. Avoid the other types wherever you can. Think of takeout containers and anything styrofoam, for example.